2, 1.
Welcome to Made for More Living.
One small step for man.
With Johnny Jennings.
Kick the tires and light the fires, Big Daddy.
The fastest and most exciting hour of news, events, and real estate in Northern California.
And this is a fact that was proved.
Powered by EXP Realty. Online at madeformoreliving.com.
Does everybody know what time it is?
Get ready. Here we go.
Matt, so I have a bit of a confession I have to make today.
It's about time.
Yeah, so most people don't know this, but I am a recovering crack addict.
You know, I was going to say something. I suspected for years that there was an issue.
Yeah.
But when you say crack, you're obviously not talking about illegal drugs here.
I'm not talking about meth. Nope. I am talking about, or cocaine. I am talking about chiropractic care. So have you ever seen those videos where like people are getting adjusted and you can hear the cracking?
Oh, absolutely. I love that sound.
I love the sound. It's like ASMR. It's my type of ASMR. And I just like watching the transformations. Like people walk in hunched or in pain, and then all of a sudden like they're feeling better, you know? And so
they walk in like the Hunchback of Notre Dame, and they walk out like LeBron James.
Yeah, exactly. So on the show today, we have Ranvir Sahota with Synapse Chiropractic.
Wow, you said his name. You must know him for a while. If you can say his name that fast.
Ranvir is the only other man that's allowed to touch my wife. Let's just put it that way. Because
Wait, say his name again?
Ranvir.
What's your last name?
Sahota. Am I doing this right?
You are.
Because we've been friends for a few years now. You've never.
You just said it so fluidly and fast, like you've said it number of times.
We have gone through some life events. So how I met Ranvir was at the birth center, right?
Correct.
The California Birth Center?
California Birth Center.
Oh, you work with Trish and all them?
So we do work with them. And the main way we met is we were actually in the same class because our wives were pregnant at the same time.
Oh,
yeah.
got it.
So I was the first. You guys had a daughter, and we were having a son, and so we were going through the birth classes, and everybody else kind of had like regular jobs, and like they were employees, and Ranvir rolled up in this nice car, and we're like, oh, what does he do? He's a chiropractor.
Oh my gosh, seriously.
And then we could like relate.
What are you, a girl? Well, look at his car. Let's go find out what he does for a living. Find out if he's single.
No, I was like, okay, well, this dude looks like he's like operating on a level that maybe we can have things to talk about. And sure enough, talking about being self-employed, having to work, like, Valerie gave birth, and then, a couple of days later, she was back at it. Rumman. Your wife's name is Rumman. Correct. His wife's name is Rumman. And so, anyways, that's how we met. And so, not only has Ranvir adjusted me and Valerie, he's adjusted Jack. He's helped Valerie through like the second birth, the second pregnancy, because we didn't know you through the first pregnancy.
That's right.
It was more like the mid, right?
Right.
And now Valerie's like, oh my gosh. So, anyways. I go about once a week, just full disclosure. I'm not paid to say this. Ranvir's not giving me a discount. I don't believe in the buddy discounts. I want to pay full price if they're doing a good job. But I go about once a week. So I see Ranvir once a week, and Valerie's probably about every 2 weeks.
Can we start real quick with, since you brought it up, treating children? About what age? Because I've heard some chiropractors even adjust babies like when they're weeks born.
Yeah, he did that with Jack. But what's your take on it?
Yeah, absolutely. So when it comes to checking babies, it's really doing an assessment to see if there's anything going on. And the main thing is that babies are hanging out in the womb for 9 months, floating around in water, and then all of a sudden they come into life.
Gravity.
Gravity. They get pulled out most of the time. And especially if it's a C-section versus a natural birth, you're going to have a lot more of a pull to get the baby out. And so the first trauma that the baby experiences is at birth. The process is just as traumatic for babies as it is for the mom. And we allow moms how much time to recover after birth and really get things together. But no one really thinks about what the babies went through. And so we check babies within the first month for most of the moms that come into our practice. And it's not necessarily making an adjustment, but it's just checking to see if there's anything going on. We want to make sure that all the reflexes are intact. We also want to make sure that head positioning, that's a big one nowadays, is normal. Some babies will really favor one side over the other. And so as they're developing, that can often lead to a scoliosis. And so we want to make sure that everything spine-wise is in proper alignment. And doing that first check within the first month is a good time to do it. I actually adjusted my first daughter on the first day within the first few hours when I was at the birth center. And the reason is that she was born and she was lifting her head up straight out of the womb. And most people would look at that and be like, oh, baby has such a strong neck, can already pick up the head. That's a good thing. But for me, knowing everything myself, that tells me that there's a ton of tension in the muscles in the neck and the upper back area that shouldn't be there. And so I ended up adjusting her right away, and she slept for almost 2 hours right off the bat.
Wow.
Allowed my wife some time to recover. But what we figured out afterwards is the reason that she was doing that is she actually had oral ties. So she had a tongue tie, a lip tie, and a cheek tie.
Wow.
And that's why she had all that tension coming out of the womb.
That's crazy.
So to answer your question, hours, I guess.
Yeah.
Yeah, I mean, Jack got adjusted at one point early on. He was like crying and fussy, and it was his arm. One of his arms was not doing something because I think he came out like a diver.
Raising his hand?
Yeah, he like had his hand raised.
I have a question.
And
Can you put me back in?
and so his shoulder and his neck was kind of jacked up. And then as soon as like Ranvir just adjusted him, he like you could just see like this little kid just all of a sudden baby like just relax.
Yeah.
So
Isn't that
anyways,
amazing?
Yeah.
And I've even adjusted Ben.
Oh, I haven't been there for any of those though.
So Ben
I was like, Ben who? Oh yeah, that's the second kid.
There's also a Ben.
There's also a Ben.
Yes.
But yeah.
Are there any other kids that Johnny Jennings might not be aware of that he's the father of that you've treated?
Hey,
That's it so far.
so far, as far as we know. But yeah. So obviously, I've known Ranvir now for at least 3 years.
Yeah.
Ben's Jack's 3.5, and so Jack and your daughter play. So they play together. He's been a part of our life now for years, and so I thought it'd be a great idea to have him on the show because we've benefited from his services, and Valerie grew up going to chiropractors, so she was raised in that. I was not. I was super anti it. I thought they were quacks, witch doctors. I didn't believe in it. But what changed my opinion was I had just started dating Valerie, and I was doing dips at the gym, and all of a sudden my chest just popped and I had this like searing pain.
Oh man.
And what happened was I separated my sternum. And so my sternum bone was like, you could see it like popping out of my chest. And I'm like, well, crap, that's not good. I just started dating Valerie and she's like, well, hey, how about you go to a chiropractor? I'm like, no, that's not that. I want to go to a real doctor.
Right, exactly.
And she's like, well, no, just go to the chiropractor. And at the time my insurance covered it. And so I went, and that son of a gun, he was able over the course of like a couple months, put it back in. And like, I have no issues. I didn't need surgery. I didn't need anything. And in the process of going there, I also had headaches. Like I had just been living with headaches. And so while he's working on my sternum, he also would adjust my neck. And then I noticed my headaches. Like I never had a headache again. And I was like, okay, I'm a believer in chiropractic care now. So anyways, we've been to a lot, but we haven't been. So in the local area, we've probably tried, because we moved up here in January of 2018. So we're not from the area. But we've probably been to somewhere around 20 different chiropractors.
Why? Why so many? Why are you hopping around?
Because Valerie has a trick neck. Like Valerie, there's only been two chiropractors. The one that she grew up going to in Bakersfield and Ranvir that can adjust her neck. And so
you've tried different chiropractors that can address her neck, and none of them have been successful in doing that except for the one in Bakersfield and
Ranvir.
Where are you from? Are you from Bakersfield? Maybe it's something to have to do with Bakersfield.
No, he's way cooler than Bakersfield.
Most everybody is way
My wife's from Modesto. That's kind of like Bakersfield.
Oh, you're from Modesto?
No.
My wife is from Modesto.
Oh, okay.
I was born in the Bay Area, but raised up in Washington State.
Oh, there you go. Love it. Yeah.
So anyways, that's why he's on this show, because again, we've probably been to 20 different chiropractors in the Sacramento region, and Ranvir with Synapse is different. I've known you for years, obviously, and can you just share a little bit about the genesis of like why you became a chiropractor and how you came up with Synapse?
Yeah, absolutely. So for me, it was the same thing as you. It was a personal experience that got me into chiropractic. I was a cross-country runner growing up. I ran track and I played basketball. And so for me, I started getting injuries around my junior year in high school where I started feeling knee pain, back pain, and I didn't really know why, other than the fact that I was probably putting in 500 miles every summer just training to set PRs and
Yeah.
So what
Can I pause you right there and ask a quick question? Because
Yeah.
you mentioned running. Is running a bad exercise? Is it bad for your body?
I wouldn't say running is bad for your body, but it does put a lot of wear and tear on your body if you're doing it excessively.
Okay.
But
Like it was for you then?
it was for me, and there's a reason why it was for me though, because your body has the ability to adapt to whatever you're putting it through if everything is functioning the way it's supposed to be.
Right.
And for me, things weren't functioning the way they're supposed to be. So I ended up going to a medical doctor because I didn't even know what a chiropractor was at that time.
Really?
And so I went to a medical doctor, and he literally looked at me for like 5 minutes, asked me a couple questions, told him where my pain was, and he said, well, why don't you just take a month off from running and everything should be better. And at this point, when I had gotten to the doctor, I was already a senior, and it was my last year. I'm like, I can't take a month off from running. That just pretty much ends my season right there. So what I decided to do was try physical therapy instead, because that was the other option that they gave me. So I went to a physical therapist, and it did help me. I felt like I was getting a little bit stronger, but my pain was still there. It wasn't going away. And that's when my dad recommended going to a chiropractor that he knew. He had been in a car accident, and so he went to a chiropractor for a while, and he said, hey, why don't you try this guy out? I went over there, and it honestly was just eye-opening for me, because this was my first experience with the doctor that spent time actually showing me where my body was at, taking x-rays and showing me the imbalance that's going on. And this is terrible, but back then I used to wear my wallet in my back pocket.
Yeah.
Did you have a George Costanza wallet? Do you know what that is?
No, I don't.
Thick old
From
wallet.
the movies or from the show Seinfeld, George Costanza had a wallet like this,
Okay.
like 5 inches thick, because he'd put everything into it, pennies, candy, and so when he sat down, he was a little lopsided.
Yeah.
I don't even carry a wallet anymore for that's part of the reason.
But he saw that you had the wallet.
Yeah, he asked me, like, he saw my x-rays and he saw an imbalance in my
Yeah,
hips, and
there
he
you
said,
go.
are you wearing like something in your back pocket? And I told him I wear my wallet in there, and I sit in class and all that all day. This is when I was in high school.
Yeah.
And he's like, okay, first thing we got to do is take that out.
Yeah.
And then we're going to work on balancing your hips out. And within a couple of weeks, things just started changing for me, started feeling a lot better. And then I started looking at it from, well, if this has gotten me out of the pain that I had, how much can this actually help me with my performance when it comes to running? And so that's why I continued going. And that was my why at that point. I saw so many people coming into the office, people coming back over and over because they're getting the changes that they want. They're seeing their lives change. And I wanted to do the same thing. And so I knew right out of high school that I was going to be a chiropractor. So I went to college, focused on
So you didn't want to be a
just-
track and field star.
No,
You gave up on that.
gave up on all that. I knew those, there was chances of those were slim. So
Because I got to carry my wallet in my back pocket.
So I decided to go into university, focus strictly on chiropractic, got all my prereqs, went straight into chiropractic school, and I graduated by the time I was 27. And
Is that fast? Is that slow? I don't know.
it is pretty fast. I mean,
Okay.
you're right on track with everything else. A lot of people that come to chiropractic school, they usually come after they've tried one or two other professions.
Okay.
And now
Were
they
your
wanna
parents
shift
on
into
board with
something.
this? Like, hey, why don't you go to real medical school? Why don't you become a real
Yeah.
doctor? If you're going to spend all this money in these years of education, why chiropractic?
I think because my dad had the experience with the chiropractor himself and he knew my passion for it, he was open to the idea. But being in an Indian family, and looking at my wife's side of the family, everyone is real doctors.
Are you serious? I didn't know that.
That's why I said that. Yeah,
exactly. So it's funny, but the cool thing now is whenever we have family gatherings or we get together,
you have to sit at a different table. No,
you're gonna sit with the kiddie table, Ranvir.
Well, to be honest, you guys somewhat differ in the way you treat people, wouldn't you say? You're more of preventative care and kind of like natural, allowing the body to heal itself, whereas medical doctors are all about drugs.
Yeah, absolutely. And it's hilarious because when we are together in those settings, all the parents, family members are coming to me for advice or want me to work on them, whereas they can't do the same thing with any of the other cousins that are there.
Exactly. Book an appointment with my receptionist.
I'm like, why don't you ask them for some pills right now?
Yeah, exactly. There you go. Get a prescription.
Yeah, exactly. And they'll laugh about it because they're like, oh, he can't do anything for me right now. He's not going to write me a prescription. And I'm like, okay. But yeah, and on that same topic, one of the biggest things for me, from a mindset standpoint, is if I'm going to do something, I like to dive 100% into it. So me personally, I haven't even taken an Advil or a Tylenol in over 14 years.
Oh, so wow.
I haven't taken...
You're tougher than I am.
In my body, yeah. And there's been some pretty bad hangovers and things like that where I've avoided those. So I would say, now I'm at that point where, it's just, it's more of a lifestyle for me. And when other people in the family see me, they just want to jump in and know what I'm doing differently, and it makes a big difference just helping everybody else get on board.
But I love that story. So it's not like you got into chiropractic for the money or, for the profession. You got into it because you had a personal experience, a positive personal experience. You wanted to help others.
I had no idea how much money you could even make in chiropractic. So that was not even a goal of mine. The one thing I knew was that I wanted to help people the same way that I got help from chiropractic.
Mm-hmm.
Was your wife, where'd you meet? Did you meet your wife in high school or?
No, actually I met my wife after high school, while I was in college, and she came, like I said, she comes from a medical family. Both her parents work in the hospital. Yeah. And she's an x-ray tech herself. Now she does mammography. And so she had a lot of issues going on when we first met. She was experiencing headaches, digestive issues. And so, I think she married me because I am a chiropractor. That's probably why she married me.
So not only did it heal you personally, but it helped you find your wife.
Yeah.
Hey, I hope one of my kids might become a chiropractor, because then that's like, they're younger than me, so it's like free adjustments for life, son. Come on. All right. When we come back, we're going to be talking about stories where you have helped people and how you've helped them.
With all the ups and downs and uncertainties in the stock market, all the unanswered questions, I'm sure you would appreciate a sure thing, a guarantee. Listen up. Johnny Jennings and his team at Made for More Realty, right now they've got this special offer where they're guaranteed to give you at least 3 cash offers on your home in as-is condition. No need to do costly home repairs or stagings or showings or getting things organized. It's simple, it's easy, it's convenient. Again, they say there's no guarantees in life. Well, they haven't talked to Johnny Jennings and his team at Made for More Realty. Again, 3 guaranteed cash offers on your home in as-is condition. Just Google Johnny Jennings with Made for More Realty and get more for your home.
This is Made for More Living with Johnny Jennings, powered by EXP Realty. Online at madeformoreliving.com.
So, Matt, I am training. Did I tell you this? I'm training for an Ironman.
I'm trying not to laugh.
Come on, you can laugh. Everybody else does.
Serious when you say that. So is this like within the next 10 years you're hoping to do an Ironman?
Come on, Matt. Come on. No, so I'm actually doing a half Ironman in Santa Cruz with JJ. I could not get him to commit to the full. Hopefully he hears this and he'll commit, be a man. But so the reason why we're doing the half is because I have a buddy. He did a half, and he wears the Ironman gear.
So
do you know what it is?
Ironman. Is that the cycling, the swimming, and
triathlon?
The running?
Yeah. So the half is I think it's like 1.3 mile swim, a 46-mile bike ride, and then a half marathon. So 13.1 miles.
Yeah.
So all consecutive.
It's doable.
Very
Yeah.
doable. But my buddy, he was wearing like all the Ironman gear, and I was like, dude, I didn't know you did an Ironman. He's like, well, I did a half. And we were in like this group setting, and so he kept having to say that over and over and over to everybody else. No, I actually did a half. No, I did a half. I was like, man, I don't want to have to say that. I want to do the full, you know? And so in October, there's one that takes place here in Sacramento. And so I will be doing the full Ironman.
Oh, really? You're doing the full Ironman.
That's the plan.
What? And this is in October?
October.
So
19th.
In your training, how far have you been running?
So
that's the most challenging part, is the marathon part.
So most people are scared about the swimming. I'm decent with swimming. Because I swam.
You do the swimming first.
Because I swam in high school. Yeah, but people are scared. Like you're swimming in the river, or you're swimming like the ocean in Santa Cruz. Like people are scared because they think you'll sink.
Where are you swimming in Sacramento? Is it
the river?
Like,
the river.
Oh, the river.
Mm-hmm.
Wow. Okay.
Yeah, and then
so how far do you?
I'm most nervous about the biking because I didn't even own a bike until like 2 weeks ago. So I was nervous about that. But as far as running, what I did was I've never been a runner, by the way. So normally when I would run around the 3 mile mark, I would start getting shin splints. And then, it'd become painful and I'd stop and then I'd start up again. And it's screw it, I'll never be a runner. But now I'm committed to this. So I'm having to figure out a way because I don't want to be that guy that quits, And so I see Ranvir every single week, typically on a Wednesday evening. I have my adjustment with Ranvir, and I was telling him, he's like, dude, you see, like because as he's like doing his preliminary like diagnosing, you like, hey, something's up, like what's going on? And I'm like, dude, I've been running a lot, and so I started off at 1 mile, and then I was doing like 2 miles and 3 miles, and then I got it up to about 10, and then I had an injury. I ran on the sand and got blisters on my feet. And so I'm.
Is this in Cabo?
Yeah, it was in Cabo. Yeah, I got 6 massive blisters on my feet. So don't run barefoot on the sand for 6 miles. It's not a good idea. But now I'm working my way back up to. I'm at 6.
Gotta take care of your feet. Gotta take care of your feet.
Gotta take care of your feet. But if the only reason why, so I've broken that 3 mile barrier that has plagued me for 20 years.
Yeah.
And it's 100% because of Ranvir, and that's. So that's something that I think is really helpful. Like if you're training, or if you're maybe just going through life generally, and you have some pain, go check out Synapse Chiropractic. They're in Rocklin, and here's what he does. I think he giggles. He giggles when he adjusts. So
he's laughing at
because he's got one of those. What are those things called?
Theragun.
The Theragun. And have you seen those, Matt?
Yeah.
Like I have one at home, and I'm like, it does not hurt as bad when I do this to myself. But like he has me like wriggling, and like my hands start sweating, and it hurts so bad. But when I leave, I feel so good. So, anyways,
does it really hurt? Because my wife has had that done, and she doesn't feel any pain.
Well, why does it hurt me so much?
I think Johnny has a few more issues than your wife does. No,
there we go.
So. It also depends on the location that you have to use it on. And so for him, when it's the shin splints that we're talking about, we're using it on the calf area.
Yeah.
And that's a very sensitive spot for a lot of people when you're getting the Theragun on that area.
Man, it hurts so bad.
My wife ever had it on there.
But and also he's like, he gives me suggestions like, hey, I'm having this pain. Hey, I'm running through this. Well, try this exercise. And I do the exercise, and I tell you what, like it has been life-changing. There's no way I'd be running 6 miles on the sand, let alone 10 miles on a freaking treadmill without Ranvir helping me through that. Like there's 0% chance. So but you don't have to be doing an Ironman to go see Ranvir.
Right. Would you recommend that he do an Ironman? Is that good for his body to go under that much abuse?
It is going to be a lot of abuse, but he's taken a good approach to it. He told me early on when he was thinking about starting to train for this, and we came up with a plan on what we needed to do and how we're going to gradually build him up to being able to run that full marathon.
I just have to follow the plan. That's the tricky thing.
He decided to run 6 miles on sand barefoot. That was not part of the plan. That was not back a little bit.
That was not prescribed by Ranvir.
So I have a tough question for you. A certain percentage of our listeners believe in what you do. They go to a chiropractor. A large percentage of our listeners don't go see a chiropractor. They don't believe in what you do. How do you talk to those people?
Yeah, I mean, I think the biggest thing for me is getting people to understand what chiropractic is and what chiropractic is not. And it always comes down to people believing or not believing. The best thing is that whether you believe it or not, it can still make a difference in your life. We have people that have come to us because chiropractic is their last resort. They've tried everything else and they have no other option. And they literally tell me like, hey, this is the last thing I'm trying.
Yeah.
And I'm like, thanks for the compliment. But yeah here we are.
Save the best for last.
Yeah, exactly. But I look at that as a challenge for me. And I'm like, okay, if I can get this person to just understand what's going on with their body, that's going to put them ahead of the game, because I've been through this experience myself.
Yeah.
I tried going to the medical doctor to get relief. And when it comes to functionality and performance, I think just understanding the body makes a huge difference. If you know where your body is right now and where you need to get it to, you're going to do the things on your own at home to start making some of those changes. Now, the plan that we come up with for what we're going to do in the office is more so has to do with the nervous system and the spine itself. When people come into our office, usually their body is under some sort of stress. And when your body is under either a physical stress, a mental stress, or a chemical stress, your body is going to start to develop compensations. And when it starts to develop these compensations, they hinder your body from functioning at 100%. So the job of chiropractic is to remove any interferences in the nervous system that aren't allowing your body to function at 100%. So really, it's your body that's going to make the recovery. I know a lot of people say, like, my chiropractor did this, my chiropractor saved my life, but all your chiropractor is doing is removing interference from your nervous system to allow your body to function better. And I think the biggest difference between that and how we look at the medical system is when a medical provider comes in and they're working on an area, people are looking for a cure or a fix. Mm-hmm. And it's like, here, take this pill. This is going to fix your issue. When all it's doing is it's actually covering up the underlying issue that's going on. When you're taking a blood pressure medication, it's normalizing your numbers, but it's not correcting the root cause as to why your blood pressure might be high.
That makes sense. So you mentioned what chiropractic is and what it is not. Like, what would you say chiropractic is not? Yeah,
so when I talk about chiropractic with my practice members, I really don't like to look at it from a diagnosis standpoint and put a diagnosis on somebody and say, this is the problem that you have going on. And a lot of times when you give someone a diagnosis versus just educating them on what's going on with their body, now they start to look more into that diagnosis, see what other things it could lead to, and people start to stop themselves from being able to heal. And the most important thing for me is giving you a better understanding as to what's going on with your body, right? So we're not going in and we're not curing any diseases. We're not really looking to do anything other than allow your body to function better than it is when you're coming into our office.
So can you give me like an example, like what that would look like? Like you can use Valerie or me if you need like patience.
Yeah, like let's say you come in and you're having, this is a common one that I see that happens a lot, is people get diagnosed with migraines.
Okay.
Right?
Yeah.
And they've been taking migraine medication, and now people feel like they have to take that medication in order to manage their migraines and keep them at that same level. Instead of them being able to focus on what may be causing those migraines to happen underneath the surface. Could it be a postural issue? Could it be that your neck is coming forward and you're putting more tension on the muscles in through that area? All we might need to do is correct your posture, get you drinking a little bit more water, getting you doing some exercise.
That water, everybody's telling me to drink more water.
And that could be something that fixes that issue. But now when you've given someone a diagnosis of migraines and put them on medications, they feel like they have to rely on those medications in order to manage their migraines.
Yeah.
Here's another like I'm a big advocate of chiropractic care just because I've seen what it's done for Valerie and done for me. So I have ways that I like to answer this question, but I'm curious how you would respond to people say, well, if they're actually fixing you, why do you have to keep going back?
Yeah.
Like how would you respond to that?
That's a great question. And so my approach to this is if someone comes into my office initially with an issue or a complaint, we're going to spend an initial time period to actually correct whatever issue they have going on, right? Once we've corrected that issue, now we're seeing you less, and we're seeing you more on a wellness or maintenance basis to be more preventative and stopping any new issues from coming about, not necessarily still treating that same problem that they came in for.
Oh, that's good.
And so the other thing with that is life now is crazy compared to what it was before. You know, we were hunter-gatherers. We were up and moving around, looking, and now everybody sits at a desk for 8 hours a day, clicking.
Looking
and we
down
have
at their phone.
So much more mental stress than we ever had before because everything is about making money. I don't have this. You look on social media, people have this, I don't have that. And it's just stressing people out. And there's so much more stress nowadays than there was before. And before we had to actually hunt for our food. And we have more stress now than we did back then because we're not physically using our bodies for what they're designed to do. Right? We're sitting in chairs all day. And so when you're constantly putting that stress, your body's going to wear down a lot faster. And so that's why we want to take more of a preventative approach, at least do something. If you're not coming into the chiropractor, you better be doing some sort of exercise routine. You got to have some sort of spinal hygiene routine that you have going on because, you know, we brush our teeth every day, right? At least we should be. And so we do that to prevent
Brush
cavities.
before you go to get adjusted. I always try to put a mint in for Ranvir.
We try to do that so that we can prevent cavities or decay.
Yeah.
That same sort of decay happens in your spine when you're not getting movement. And so the thing that we try to encourage people to do is get movement. But for the areas that they may not be getting the movement that they need to, that's where the adjustment can come in and help restore motion back into segments that may be more restricted or stuck.
I love that. Like you fix the issue, but maybe other issues pop up. I always just say, hey, did you brush your teeth this morning? Yeah. Are you going to brush them tomorrow? It's not a one and done type of thing. Did you shower today?
Right.
Okay. Are you going to shower tomorrow? Like it's just part of maintenance for your body.
Yeah, because they said, going back to the lifestyle we now lead, where we're sitting more, they said sedentary sitting is just as unhealthy as smoking.
Correct.
Did you hear that?
The sitting is the new smoking. That is the
the
saying.
sitting is the new smoking.
That's why I smoke cigars standing up. I figure it cancels it out.
Speaking of that, then, is it a good idea? Is it helpful to have stand-up desks, which seems to be very popular now?
Yes. Stand-up desks makes a huge difference. Because posturally you're going to be in a totally different position. The other thing with that too, though, is that you standing up or doing anything for an extended period of time can put stress on your body. So standing up may be good for somebody that has their pelvis balanced, but it may not be good for somebody who has an imbalanced pelvis, and now they're standing up and they're putting more stress on their hips and their knees, and they start noticing other issues going on. So you want to look at the whole picture, make sure everything is balanced, and then if you're standing, it's definitely going to be a lot better for you.
Man, that's a very detailed answer.
Do you have a stand-up desk?
Yeah.
You do?
Absolutely.
At the office? Oh,
Yeah.
good for you.
Yeah, so another chiropractic story. This was before I knew Ranvir. Actually, you know what? When we come back from the break, I'm going to tell a chiropractic story.
Question for you. How does someone earn over 1,000 5-star Google reviews? Well, maybe they deliver on their promises. Maybe they fulfill their guarantees. Like, for instance, Johnny Jennings and his team at Made for More Realty, they guarantee to get you at least 3 cash offers on your home in as-is condition. No need to do costly home repairs or organization or stagings or showings. Simple, easy, convenient 3 cash offers on your home. Just Google Johnny Jennings with Made for More Realty and get more for your home.
This is Made for More Living with Johnny Jennings, powered by EXP Realty. Online at madeformoreliving.com.
Matt, have you heard the curse of the Taz?
I've heard the curse of the great Bambino.
Bambino, not the
That's
Taz.
Babe Ruth. The curse of the what?
Taz.
No.
No.
Curse of the Taz?
Yeah.
No.
So I learned this in
Is this a real estate thing?
No, it's not. I learned this in a Mexican food restaurant in Elk Grove.
Things you learn at a Mexican food restaurant in Elk Grove.
In
we
Elk
could write
Grove.
a book about
There
that.
you go. So I was sitting there and having dinner with Valerie. We had gotten out of appointments, and we were like just happened to be in the same city, so and we hadn't seen each other in a while because we're always like ships passing in the night. This was before kids, and I'm like, well, hey, we're in the same city. Let's go eat at this Mexican restaurant around the corner. She's like, sure. So we sit down, and like I'm like sitting kind of funny because like my back's really hurting, and the guy. The server comes up and goes, hey, what's up? Are you in pain? I'm like, oh, yeah, my back hurts. And he's like, how old are you? I'm like, 30. He's like, yep. I'm like, what are you talking about? He's like, the curse of the Taz. I'm like, what are you talking about? He's like, well, in Spanish, it's like 10 is 10, 20 is 20. But then you get into 30, 40, 50, 30, 40, 50.
Sure.
All the Taz. So those are the Taz. 60, the Taz. So you're looking at me like you don't understand.
I don't.
30.
Right.
I might be saying this wrong.
So the curse of the 30s.
Yeah. So the Taz. So once you hit 30, at the end of every decade.
Oh, okay.
is a Ta.
So there's no obviously. I thought there was some kind of like scientific aspect to this.
No, there's no scientific.
Well, when you turn 30, your body starts to break down.
No, so it's the curse of the Taz. And so I was like, oh, that's hilarious. I'm never going to forget that.
I think that's probably the last time we'll ever talk about the curse of the Taz, probably on this show.
Okay, yeah. Well. Next week I'm bringing it up. I'm going to find a reason. But anyway, so my back.
Just a reason to head down to Elk Grove and try some Mexican food. Find out about the curse of the Taz.
We'll have him on the radio show. We got to find that server, have him on the radio show. But my back was hurting, and I could not find. We tried a couple different chiropractors. It wasn't working. I tried this lady. She did have you heard of Bowen, Ranvir?
I have.
Bowen. She tried Bowen. It was not helping. But
is that a chiropractor?
No, I don't even know. It's like a form of like
it's a different technique.
It's a different technique.
More
yeah.
of like it's a mix between like massage and chiropractic.
Oh, okay.
Yeah. So anyways, didn't work. Super nice lady, but didn't work. And anyways, I found a chiropractor because here's the thing: is that I think what happens to some people is they have experiences with a chiropractor and they think that's how everybody is. But not all chiropractors
Good point.
are equally skilled.
Yeah. Not
all real estate agents are equally skilled. And so I went to a chiropractor, and he was able to fix my back. Turns out I had, and still have, L5S1. Does that sound correct, Ranvir? Okay.
It does.
So L5S1 is bulging, according to, he took a picture of it or whatever. And so he put me on this traction machine. He was able to relieve some of the tension on that. And so moving forward, I have, I've just been using an inversion table to keep it at bay. But he also told me that sitting puts 4 times the amount of pressure on your back as standing does.
Yeah.
As soon as I heard that, I'm like, okay, well, screw this. I'm getting all the chairs out of my office. So I don't even have a chair in my office.
Really?
It's just a standing desk, and it's been that way since 2019. So, yeah. But again, chiropractor helped me with my back. Whenever I'm having an issue, I know with my back, I either need to hit that inversion table, spend some time on that, or get adjusted. So... But you had some interesting questions, Matt. For example.
So going back to folks that are listening right now, and they're still skeptical of chiropractic, and many of them are not, though. Like my wife, she goes and sees a chiropractor. She believes in it 1,000%. Like I said to you off the air earlier, she's been in 9 car accidents even before she met me, and so she needs that chiropractic care. But for folks who are a little bit skeptical, Is there research on the effectiveness of chiropractic care, how it works and how it's effective and how it's helping fix our bodies? Is there research out there that the medical community can look and read?
Yeah, absolutely. So there's a lot of research now that's coming out more so relating chiropractic adjustments to the brain and the effect that it actually has on the brain. Because when you're able to get adjusted, most people just think of it like you're getting that popping sound and you're getting that release. And
it's like popping your knuckles, but for other
exactly. Parts, yeah. It might just be a little bit of air releasing from that joint. Very nice, very nice. You've done that before.
Is that good or bad for you?
It's fine as long as you're doing it.
Because you always heard that from your grandmother. Don't crack or pop your knuckles.
You're gonna get arthritis. So it's okay.
In
if
the
you
knuckles,
do it?
It's not a big deal, right? It's worse when people are really twisting their neck into an awkward position to try to get things to move, because usually the reason you do that is you feel things are a little bit restricted, not quite moving the way they're supposed to. You get in there, you pop it, it releases some of that tension in there.
Yeah.
Now the problem in the neck is that when you feel that, there's usually a restricted segment in there, and you just going like this by yourself isn't going to allow you to reach that restricted segment. So you end up moving segments that are already freely moving, and you get increased motion into those areas, and oftentimes that could lead to instability in the neck.
All right, going back to the research.
Yes, let's go back to the research. So a lot of studies now are showing the effects that chiropractic can have on the brain. And the biggest thing that we see is that most of the time when people come in, their body's in a stressed out state. Now, when you're in a stressed out state, your body is releasing more cortisol and adrenaline. And what the research now is showing is that when you get a chiropractic adjustment, it actually shifts your brain to starting to release more dopamine and serotonin to counteract that cortisol and adrenaline that's going in there. And so if anybody wants to look up research, Heidi Havoc from the Havoc Institute of Research has a lot of great studies that they've been doing on chiropractic and the effects that it has on the brain. And then just structurally, when you look at it, if something isn't quite moving the way it's supposed to be, and there's a lot of studies on this, and you restore motion back into that area, or you get that range of motion back into that area, you're going to be able to prevent a lot more injuries from coming about. And so those kinds of studies are a lot easier to find, but I'm coming from an office that's more neurologically based. I like to see the effects that it has on the brain and allowing the body to function better overall.
So are these studies published in medical journals that the medical community, as far as, traditional doctors, that they read and understand, and do they respect that research?
Yeah, I think now compared to before, it has started to shift that way, where there are a lot of these studies that are showing up where when these studies are done in medical journals, it's more so called manipulation versus an adjustment. Now, adjustment is just a little bit more specific versus a manipulation. A manipulation is more of a global movement through an area, whereas an adjustment is a specific movement. And so a lot of these are showing up in medical journals, and there's a lot of studies. And then the biggest thing that you'll notice now is that from physical therapists and medical providers, people are starting to incorporate manipulation into their practices.
Oh, really?
So a lot of physical therapists now are doing manipulations, right? And they'll take a class and learn how to work through these areas, and then they start to incorporate it. And so I think overall, people have seen the effects and the difference that it has had on their patients. And now people want to incorporate that. And so physical therapists are definitely starting to incorporate a lot more manipulation. Osteopaths have been doing a form of manipulation for many years.
Dude, I didn't know you knew about osteo. Well, of course you know about them, but we've never talked about this. My great-grandfather was an osteopath.
Nice.
Yeah, and so he was anyways, people don't talk about those people a whole lot. They're hard to find.
They've been doing that.
Yeah, it's like something that predate. Go ahead. You know it better than I do.
Yeah, they're bone doctors. Essentially, and but nowadays here's the biggest thing is that a lot of osteopathic following under the medical guidelines has shifted from more hands-on work to being able to prescribe and under more of the medical realm. When initially when it started, it was a lot similar to chiropractic, where it was just hands-on work that they were doing through those areas.
Yep.
Do you think more people would go see chiropractors if it was covered by more insurance companies and policies?
Yes. And
why is chiropractic work not covered by more insurance policies?
It is actually covered by a good amount of insurance policies do include chiropractic. The biggest problem is that the reimbursement rates are terrible. And that's for anything that you do when it comes to medical expenses, whether you're in a hospital or you're a chiropractor. It's your reimbursement rates through insurance are not going to be great. And so you're performing a service, but as a doctor, you're not getting paid anywhere near the amount that you should be for that service. And so what happens, and you see this happen in hospitals as well, is now the doctor feels like they have to do extra services in order to get that bill to line up with what they feel is fair. And so you go to a hospital You get charged for every little thing that you do there, right?
Yeah.
It's not just going.
You use
in
the
for a
elevator.
visit.
How many floors?
Exactly.
You're gonna take you for every floor.
Yeah, and so when it's in a chiropractic office, it's the same thing. Is when you look at just getting reimbursement for the adjustment, it's not great. So a lot of chiropractors feel like now they have to throw a heat pack on somebody to get a reimbursement for that, throw you on a traction table to get reimbursed for that, just to make it add up. And so that's the reason that a lot of chiropractors stop taking insurance in general. So it's not that the insurance companies don't have some sort of reimbursement for it. It's just that chiropractors don't want to be in network with these insurance companies because you don't want to have to do more just to justify the price. And so when you're focusing on the patient themselves, yes, it does create a little bit of a barrier, but I don't take any insurance in my office.
But you can use like your health savings account.
You can,
situation?
yeah, absolutely. You can use your health savings account. So HSA, FSA, all that still includes chiropractic. And it is a tax deduction as well. So
I didn't know that. I hope my accountant knows that. Man, I'm in there every week. I'm like a gold star member of Synapse Chiropractic. I got the Synapse Black card.
Yeah, there you go.
But I love what you were saying too about the brain, because that's like, obviously, like, it's helped me with headaches. It's helped with my sternum. It's helped with my legs. It's helped Valerie with I think her hips and her neck. But one of my favorite things is when you adjust my neck towards the end. Like it's that little, was it the atlas at the top, that little bone? Mm-hmm. Like I can just feel that kind of like sliding more into place, and I just feel clear and connected. Like it's like if you're like rubbing like a sore muscle, and all of a sudden blood flow starts releasing. I just feel that in my head, and it's like, okay, I feel like I'm in a better state leaving than when I first arrived. And keep in mind, I go every week. So if you haven't been ever, if you're going inconsistently, like what are you missing out on?
I'd love to tell you a story about this.
Let's do
actually.
this.
So when I was in chiropractic school, I had a mentor that came in, and he came into, it was after school, and he was just coming in, and he said, "Hey guys, gather around. Like I got a cool story for you guys." And so we all gathered around, and he starts telling us that he went to San Quentin prison to adjust the inmates. And I'm like, okay, like that's cool.
That's cool.
But in my head, I'm thinking like, why are you adjusting inmates? And
That's a
and
smart idea.
Yeah.
I see what he's doing there.
Yeah, I didn't really understand it. And so he's like, no, hear me out. Like, I'm going to tell you guys about this experience. It was amazing. And so he starts telling us how he shows up to San Quentin, and it's really like the movies. Like they make you wait outside, they get the guards with you, walk you through, and he's like, it's so loud in there. And they finally get him into the back, and they have one room with a chiropractic table. And they tell him, okay, you're going to be adjusting inmates here. We're just going to line them up, and they're going to come through. And so he starts adjusting, and he's just going through, doing his thing, spending a few minutes with each person. And then he gets this really big guy that comes in. And he's thinking, okay, like to adjust this guy, I'm really going to have to get in there on him, right? And so he lays him down on the table, makes an adjustment to the back, flips him over, and he adjusts his neck. And so as soon as he adjusts his neck, he sits him up, and the guy's just sitting there, doesn't say a word, and is just staring past him. And he's just confused, and at this point he's like, did I hurt this guy? Like I did go in a little bit more aggressive. What's going on? And so he asks him, he says, are you okay? And the guy doesn't respond. He's just looking literally past him. And so he's like, okay, do I walk towards the door at this point? or do I walk towards him, right? Exactly. So he ends up walking to him, and he puts his hand on his shoulder, and he says, hey, are you okay? And the guy finally looks over at him, and he just starts breaking down in tears. And he looks over at the chiropractor, and he says, hey, I just realized something. He said, I just realized that the reason I'm here, I just realized the reason that I'm in prison. And this guy was explaining to him that he felt like he was carrying the weight of the world on his shoulders. And he felt so much tension. His mood was off, and it literally, him being in that state is what led him to make the decisions that he did that put him in prison. And after he got that adjustment, it was the first time that he felt clear.
Really?
And he felt that clarity to the point where he actually realized why he was there.
That's so good.
And so it was such a great story. That one touched me big time. And then that the chiropractor went on to say, he's like, hey, the reason I'm going to do this, and now it's become an annual thing where they go in there and they take multiple chiropractors and they adjust them. And they talk about how it's the day that they get adjusted is literally like the quietest day in the prison.
Really?
Yeah. And so he was telling us that one day these guys are going to get out of prison, right? And I would rather have them be adjusted and more clear when they come out so that they don't make the same decisions that put them back in there in the
Oh my
first
gosh.
place.
That's really good.
Who did that? What's the name of the guy again?
So this was Dr. LaCara that came in and he was telling this story.
What a great idea.
Yeah.
Oh my gosh.
Yeah.
Brilliant. Brilliant idea.
But that's exactly right. Like when I get adjusted, I feel like the words that come to my mind are clear and connected.
Yeah. Well, you hear so many people, you see it in your kids, I see it in my kids. If you're tired, you're hungry, or you're in pain, you're not going to behave like you're in your right mind.
Exactly.
You know, you're acting out of that, you're not in alignment.
Exactly.
Using a chiropractor.
There you go.
And so
Dr. Matt over here.
It's so on point, you know, going into those prisons and possibly looking at ways to treat these prisoners who may have a similar story to this guy where they've been acting out of just pain that they've been feeling or whatever the situation is. I love that. So that's more than just treating the body. That's treating their mental and, if you will, spiritual health.
Absolutely.
You know?
And that's one of the main reasons that we called our practice Synapse Chiropractic, because we wanted to connect on a deeper level and make sure that we're making that same sort of change for people when they're coming into our office. Because as you guys know, that one person can have a ripple effect on the rest of the community, right?
Yep.
So if you can change the life of one person, that person can change the lives of 10 to 20 other people.
Absolutely. And so when we come back, we were actually going to talk about...
Oh, we're out of time.
Oh, we're out of time?
We're out of time.
What, man, where did the hour go? That was so awesome. So Synapse Chiropractic, located in Rocklin. Google them. They have tons of reviews. Is that the best way to get a hold of you? Just Google Synapse Chiropractic?
Yeah, Google, give us a call.
And they'll get you in. Awesome. All right. Thanks for being on the show, Ranvir.
Thanks for having me.